Addiction, families in distress. Hello and welcome to Dumi's Daily Grind. Thank you so much for joining me today. I hope you're doing well. My name is Dumi and my journey began on the 13th of October 2021. If you are new, here I talk about recovery, spiritual growth, mental health issues, sobriety, relapses, and spiritual well-being, focusing mainly on the daily work, the grind, that goes into finding peace of mind, contentment, and freedom from addiction. If this is something you are interested in, please subscribe and hit the notification bell as I release new content regularly, and hopefully we will travel together on this journey toward finding enlightenment. This topic was suggested by a regular listener who requested I keep their anonymity. As a member of al-anon themselves, they have experienced a lot of pain, hardship, and suffering linked to a family's member's addiction. However, they have grown to understand how addiction is a family problem and how they can contribute even without touching any substances or engaging in behaviors associated with addiction. With that said, let's get into it. Addiction is a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequences. It is further explained as a person's inability to stop using a substance or engaging in a specific behavior, even though the behavior causes psychological, physical, and societal harm. The NHS UK defines addiction as not having control over doing, taking, or using something to the point where it could be harmful to you. Addiction is most commonly associated with gambling, drugs, alcohol, smoking, overeating, and we can be addicted to just about anything, including the internet, work, shopping, sex, and even technology. We can usually see the signs of addiction as the addicted person shows an impaired ability to maintain self-control. Some signs include, but are not limited to, social changes, behavioral changes, health-related changes, and a general personality change. You may notice behavior and emotional changes associated with addiction that include poor assessment of the impact of using the substance, an addict blaming others or people with their problems, increased levels of anxiety, depression and sadness, increased sensitivity to stressful situations and other severe reactions to stress, trouble identifying feelings, physical sensations, and one's emotions. The causes of addiction are usually associated with the brain's frontal lobes, which are responsible for delaying a person's feelings of reward and gratification. However, in addicted people, there is a malfunction in the frontal lobes and gratification is experienced immediately. One of the other areas of the brain associated with pleasurable sensations may also increase a person's response when exposed to addictive substances and behaviors. Other possible causes of addiction include chemical imbalances in the brain and mental disorders such as schizophrenia or bipolar disorder. These disorders can lead to coping strategies that become addictions. Did you know that genetics also play a role? It is said that genetics also increase the likelihood of an addiction by about 50%. This is according to the American Society of Addiction Medicine. And one of the most prevalent causes of addiction is environmental and cultural, whereby a disruption in a person's social support system can lead to substance or behavioral addictions. Trauma Another topic that deserves its own episode can lead to addictive behaviors as one's normal coping abilities are affected. Addiction starts out as a simple, curious stage, referred to as experimentation, followed by regular use of the substance or behavior, which may become problematic, where a person uses or engages in an extreme way with disregard for consequences, and then becomes dependent and uses the substances or engages in a behavior more frequently despite the negative consequences. Long-term addiction usually leads to physical health complications, psychological and emotional suffering, social isolation, and most definitely economical difficulties, where addicted persons have been known to find themselves in deep debt or even bankruptcy. Wikipedia lists the following examples of drug and behavioral addictions to include alcoholism, marijuana addiction, amphetamine addiction, cocaine addiction, nicotine addiction, opioid addiction, food addiction, chocolate addiction, video game addiction, gambling addiction, and sexual addiction. The only behavioral addiction recognized by the DCM-5 and the ICD-10 is gambling addiction. With the introduction of the ICD-11, gaming addiction was appended. The term addiction is frequently misused when referring to other compulsive behaviors or disorders, particularly dependency in the news media. An important distinction between drug addiction and dependency is that drug dependence is a disorder in which cessation of the drug results in an unpleasant state of withdrawal, which can lead to further drug use. Addiction is the compulsive use of a substance or performance of a behavior that is independent of withdrawal. Addiction can occur in the absence of dependence, and dependence can occur in the absence of addiction, although the two often occur together. Some habits or social behaviors look like addiction, but in the case of an addiction, a person will typically react negatively when they don't get their reward. For example, someone addicted to coffee can experience physical and psychological withdrawal symptoms such as severe headaches and irritability. Addiction will affect many other areas of life. It is a pervasive condition with an impact that reaches far beyond the addicted person. The mental, physical, and social health effects of addiction can extend to people that have never used a drug or consumed a sip of alcohol. There is no immunity to the reach of addiction, and addiction affects especially the family members and society as a whole and should not be ignored. The family structure means every decision one person makes influences the other members in direct or indirect ways. When one family member struggles with addiction, the condition usually negatively affects all members of the family through the creation of heightened stress, anxiety, and depression, feelings of guilt and shame, responsibility, confusion, anger and resentment, sadness, etc., that troubles the entire family and leads to increased conflict, isolation, hopelessness, and general dysfunction. Everyone suffers in one way or another when addicts grip the family. The physical health issues resulting from an intense focus on the person's using substances rather than on one's own needs. Addiction affects the family's financial situation, which may stem from supporting an addict's habit, theft, paying of legal fees, and basic financial household resources needed for housing, utilities, and nutrition being spent on substances and behaviors as required by the addict. Addicts place children in greater risk of experiencing various mental health conditions such as low self-esteem, impaired future relationships, trust issues, violence, diminished learning capacity, and an increased likelihood of substance abuse. Addiction affects the general nucleus of the family. It affects normal patterns through increased negative communication, inconsistency, misguided expectations, misdirected anger, and increased negative coping mechanisms such as self-medication, which may start the cycle of addiction in other family members as well. Although this does not always happen, some maladaptive patterns may occur, such as codependency, which is defined as the state of being overly concerned about the addict while spending little time and energy on one's own needs. Codependent families may exercise excessive control, have lack of trust, may be overly flexible as an avoidance strategy. They become overly sensitive and may experience extreme reactions. They may also stay loyal and dependent on the person no matter what. They also enable the addict's behavior by protecting the addict from the natural consequences of their addiction through making excuses for themselves or the addict, bailing their loved ones out of jail, paying for legal fees, and otherwise staving off negative consequences, which prevents the addict from experiencing the true cost of their addiction firsthand. Children are not immune to changing family dynamics. In many situations, roles reverse, and the child begins to take on the caregiving role for their addicted parent or parents, creating extreme stress for the child, blurring of appropriate boundaries, and set the child up for difficulty setting healthy boundaries in their future relationships. Families of addicted individuals suffer from societal stigmas that perpetuate stereotypes fueled by misunderstanding and misinformation, and create self-isolation from the community and may prevent family members and the addict from seeking the appropriate help, which is freely available. Although stigmas are societal creations, one's own family can create it through living in secrecy caused by embarrassment and make codependency more prevalent. This is why addiction is not only an individual's disease, but a family's disease. Because everyone suffers, treatment requires the entire family to seek help, starting by every individual in the family structure to take care of themselves first, focusing on improving their own mental, physical, and social health. It is unreasonable to place all of the responsibility on the addict to repair the family unit, even though the initial problem stems from the addict themselves. We have to remember that addiction is hardly automatic. As explained earlier, environmental causes play a major role in creating the problem. A lot of us think that addicts created the problem on their own, and we think that they suffer alone. But this is very untrue, and any person who has experienced addiction will always attest to that. We can all recover from addiction and codependency by starting with the following basic steps: requesting and accepting help, participating in more positive activities, creating routines and goals, prioritizing our own physical and mental health, finding relaxation and acceptance of our current situations, and I found that the most impactful way of recovering is gratitude. We have to focus on everything we are grateful for and practice daily gratitude rituals that will keep our minds positive and healthy through appreciation. Then it is suggested that we utilize support groups such as 12-step or non-12-step programs that exist all over. Some examples of these are al-anon, al-ateen, Codependence Anonymous, Adult Children of Alcoholics, Families Anonymous, etc. While addicts can seek help from al-anon as well, Alcoholics Anonymous, Cocaine Anonymous, Crystal Meth Anonymous, Gamblers Anonymous, Marijuana Anonymous, Narcotics Anonymous, Sex Addicts Anonymous, and Overeaters Anonymous are some support groups that addicts can utilize. Some common therapies that should be considered include medications for mental disorders such as depression or schizophrenia, psychotherapy including behavioural psychotherapy, talk, group therapies, medical services to help treat serious complications of addiction like withdrawal during detox, addiction case management to help coordinate and check ongoing treatment, inpatient and outpatient addiction treatment programs, and you can visit your primary care physician who can also recommend some treatments depending on the severity of the condition. It is important to remember not to take too much responsibility for the behavior of others, especially family members, as it will place you in a difficult position. It is ultimately the addict's responsibility to take action and to accept that their negative choices create this suffering, but please offer assistance when appropriate. When impacted by the burden of addiction, investigate treatment options for yourself and your addict, as addiction is a family problem and it will take all of us to begin the process to repair the damage caused and repair the family structure. Thank you for your time, your support, and being with me on this journey to finding serenity. If you enjoy listening to me, please don't forget to subscribe and let your friends, your family, and your tribe know that they can also join us on this journey toward finding serenity and some peace of mind. Until I see you next time, stay well and God bless you and keep you safe today. We can recover from addiction and experience once again a solid family structure free from addiction if we work together and be diligent with the work required to achieve our goals and experience serenity and peace of mind. The answers are always right in front of us and will be revealed if we truly seek them. Let us be present, conscious, and intentional in our lives and grow positively to achieve the happiness we seek. If you have a suggested topic you would like me to cover, please do not hesitate to let me know and I will be more than willing to oblige.